Hi, I'm Dr. Sulata Shenoy, psychologist and director, Turning Point, Center for Psychological Assessments, Therapies and Counseling, Jayanagar, Bengaluru. Mental illness or mental disorders are being increasingly recognized in our lives today, and we may find that a lot of people we know may be suffering from mental illness, and sometimes these may even go unrecognized. Now, why is this? It could be due to a whole host of factors. First of all, because mental disorder, the symptoms of mental disorders are not very much different from the normal day-to-day emotions and experiences of individuals, such as where one does tend to worry, one does tend to feel sad, one does tend to feel anxious, one does tend to feel like being alone, or there may be certain inappropriate behaviors or actions which are not fully which are not fully accepted by others. So we see this going on all around us, and how does one know that this person is having a mental disorder is really a difficult question, and one cannot help but wonder about it, and that is the reason why a lot of us feel the stigma of having been diagnosed with a mental disorder, whereas we are perfectly fine and we even flaunt our physical diagnosis. Like if you have hypertension or if you have diabetes, you would make no bones about it, and you would freely at the next social opportunity you would announce it. However, if you have been diagnosed with something like depression, anxiety, etc., you are likely to keep it to yourself, not to disclose it even to the close family members, and this often leads to misunderstandings and difficulties in social interactions. So, what is it about mental disorders that makes it so difficult to diagnose and spot, especially for lay people? And even the person himself may not be aware that he or she is having a mental disorder. So, when you tell somebody, look, I think you need professional help, the person may very well turn around and say, I am perfectly fine, it's you who need help, why don't you go and get yourself fixed. So that is a common reaction when one recognizes something is not going right in the other person's life. So as a wife, as a husband, as a parent, as a child, as a son or a daughter, you want to help somebody who is exhibiting mental symptoms. You would very often be told that you are exaggerating, overreacting, and the person is perfectly fine. So what I would say is one needs to look for these three key factors. The first one is the frequency. Now all of us feel sad and upset, etc., as I was telling, depending on the situation. So if I win a lottery, I am certainly going to be very ecstatic about it, and if I have huge financial losses, then I am certainly going to be very dejected and depressed about it, as well as anxious. But over time I learn to come back to a balance, and my life will continue as before. Whereas in mental disorders such as in bipolar disorders, the person may be swinging between two extremes of emotion, that is being very happy and very exuberant to being very depressed and very dejected, upset, etc. So the frequency with which it happens. So that is, the person may be even going through rapid cycling, that is, in the morning the person may be very exuberant, by afternoon he is dull, withdrawn, and by evening again he is back up to his peppy self, and in the night again he is unable to sleep, unable to eat, crying spells, etc. So we see this cycle repeating itself a lot in mental patients. Secondly, one would say that it would interfere with his or her own normal life. Now, if I am feeling upset about something, I may still continue to go to my office, I may still continue to do my chores, whereas a person who has having a severe anxiety or severe depression is no longer able to sometimes even take care of themselves or their personal hygiene, let alone go resume their jobs or lead a student life. And thirdly, it is many of these mental disorders are chronic, that is, they do not get treated on their own, and patient may suffer throughout his or her lifespan with these difficulties. It would be best to get a diagnosis done if you as a person are undergoing any of these symptoms to the degree which I have just outlined, or you see somebody close to you also going through this difficulty, and seek help. Nowadays it is not difficult to seek help. The person is no longer institutionalized. The person can be treated very well in his or her own home, and rehabilitation processes can happen very well within the house. So there is no reason for people to stay back or stay away from or be in denial about mental illnesses, and the time has come for all of us to take steps to rectify the situation rather than let mentally ill patients suffer on their own.